Good morning, everybody, and welcome back to your Lunch Break Live. My name is Ivana Harinkyu if you're new here, and if you're not, thank you for coming back. Today is Monday, November the 15th, and today I know that we're going to have a very interesting and I think very informative conversation about the COVID-19 vaccines for kids. Now, we know that just a few weeks ago, the FDA did give emergency use approval for the Pfizer and biotech COVID-19 vaccine for kids ages 5 to 11. This was something I know a lot of parents were eagerly, awaiting. It's been a long weekend, awaiting. And now we see that these kids are starting to get shots in their arms. Now, this also brings, though, a lot of questions, especially for parents, for people who have children in their family, or people who are just interested in general. So today, I am joined by UAB pediatrician and associate professor, Dr. Candice Dye. Dr. Dye is here today to talk a little bit about the vaccine, about some of the most common questions that she has received, and to answer some of your questions. So if you have a question that you hadn't sent me already, then make sure to drop it here in the comments. I will be paying attention to those. And otherwise, Dr. Dye, we got a lot of stuff to get into. So let's just go ahead and get started. And I want to get your opinion on a study I recently read. And that was that 1/3 of parents are very eager to get their kids vaccinated. 1/3 are saying, we are definitely not getting our kids vaccinated. And then that remaining third is saying, you know what, we're going to wait and see how these vaccines play out, if there are any side effects or any semi-long-term effects that we can tell before we make our decision. So I want to see if that's something that you have seen in your practice and that's something that you're hearing as well.
Yeah, so I think there's definitely different pockets of those populations, and in the pediatric primary care clinic at UAB and Children's, we have differing families that fit into all of those, and so a lot of times it's having that conversation and allowing them to really ask us as their PCP, as their pediatricians, what we recommend and what we know, and how can we have this open conversation. To the question about has it kind of rolled over into other vaccines. I don't know that specifically we have seen it as much with routine vaccines that are those childhood vaccines that are recommended specifically in our clinic. The thing that we have experienced some is patients just not physically being in clinic because of COVID and lockdown. And so patients are behind on their vaccines because they have been, shelter in place almost kind of for a long time, and then getting back in and getting caught up on those routine vaccines.
Well, we know that kids are just now starting to get those shots. Is there any evidence that you have seen in these clinical trials or studies of evidence there could be long-term effects of these COVID vaccines in kids?
There is not. The studies are actually poured through all of the presentation slides that the ACIP did a few weeks ago. That was the meeting with to get to the final approval. And there are the normal reactions, normal response of the immune system that we know that happens. The long term are not there from the vaccine. One thing that I think continues to come up is like myocarditis, for example. And that is something that certainly made the news in the summer, and actually paused the Pfizer trial for that age group for a little bit, and then they required to enroll more patients and to do a little bit different check-in and studying with those patients. To speak on that specific example with the trial, they have not seen any cases of myocarditis. with the trial vaccine with Pfizer that is now the approved the EUA with the Pfizer for that 5 to 11-year-old.
So we have heard from the beginning of this pandemic, almost 2 years ago now, that kids have not been the people who have traditionally gotten as sick from getting COVID. Now that changed a little bit with the Delta variant that we saw really emerge this summer. We saw kids getting more sick, more kids being on ventilators in the state. While those numbers were still maybe low, they were much higher than what they had been throughout the pandemic, and they were way too high to have kids on ventilators, just in general. So let's talk about the risk benefit here. What is better, to get your kid vaccinated for COVID-19 and say, look, maybe there is some very minuscule chance there's a long-term effect,
Mhm.
or not vaccinate your kid, have your kid get COVID and not know the long-term effects of COVID on your child?
Um, I mean, I lean towards the benefits that we know that the vaccine is able to give us. I understand completely the question of the risk, and I feel like we've been in this pandemic for 100 years, but I know that we haven't been. Um, but the way out of it is with vaccines, and the it, even if it is a small risk that your child could get COVID and end up sick in the hospital, on a ventilator, and worse. That's still your child, and I don't want that for you and your child. I don't want that for me and my child, to have to do that. And that's why we have trials, and it is studied thoroughly, and the data is there, and the science is there, and to be able to know that, it's kind of like anticipatory guidance. There's so many things that you can do to protect your children, and protect yourself. And there's so many things that we can't, protect against. And so if there's something that we can do to help protect our children, to help protect ourselves, and be proactive and active in that instead of having to be reactive, then let's do it. We've learned the things. I mean, seatbelts or helmets, and things like that, to wear a helmet on a bike so that if something happens, hopefully your head is protected as best as it can be. So just that's maybe a little bit of a different comparison, but it to me it equates the same. So
That's interesting. And I like that analogy talking about the bicycle on a helmet, because you look at maybe putting something, a bicycle helmet maybe can give you a headache, right? If you're like me, you put even a headband on, it can give you a headache. But does that outweigh the risk of possibly getting into a crash on your bike and having a brain injury? It absolutely does. I don't think anybody would argue that.
right.
Now, I want to know what you say to people who say, well, look, there were only X amount of kids in a trial, and also the trial only lasted for several months. As you said, we feel like we've been in this pandemic for so long, but we really haven't in terms of calendar years. How do we really know what the long-term effects are going to be?
Right. And I think it's one of those things that the researchers that are in the throes of that um, would be able to answer this question way more than I could. But being able to have that conversation with the families and patients, to be able to try to almost kind of translate that information, so that they can hopefully understand that yes, this specific vaccine has been studied for for this amount of time, but it all has come from or started with other vaccine trials, and other. I mean, it's not that on whatever date in 2020, this type of vaccine trial was started. There's there's a lot of things that have precluded being able to have a vaccine of this type that will work. And what's the saying? There's no failure in failure unless you don't, try again type thing. I'm totally botching that quote there. But that's, that's a lot of what science and research is. And, you learn something and you pivot and change a little bit and tweak it, and then, do this. And so that's, you get to the point to where then you can do that in human subjects, and be able to move forward with it. So
You mentioned one of the possible side effects, very rare side effects, and that was myocarditis. I want to talk about another one that is a very rumored side effect, we'll say. And this is rumored for the adult version of the vaccine, the adult dose of the vaccine, as well now as the kid-sized version of the vaccine. And that is reproductive issues. So what do you say to parents who say, look, I don't want to give my child any future reproductive issues with this vaccine? Can you say for certainty, look, this is not going to cause any reproductive issues, whether in this boy or in this girl?
you know, just within, even, within like discharging a patient from the hospital. I don't ever promise anything. I hope that you're going to be able to, to be discharged tomorrow if all of these things, continue and align. But based on everything that we know, which is a lot, then that is not an issue. And the original concern of the reproductive issues, side effects, and so forth, actually is traced back to social media that was false and not anywhere related to anything with COVID, vaccine, infection, anything. And so that's, there's good out there, but trying to weed through that and know what is the truth or not is honestly has been a lot of what professionally we've dealt with, trying to debunk, so to speak, that disinformation that is out there. And just kind of another point is that who knows what's going to happen in 20 years and in 30 years or 15 years. But what we know today is that this vaccine can keep you from being inpatient, sick as stink, and on a ventilator or worse. And so varying degrees of that. And so I can't, if you aren't vaccinated, it doesn't give you any protection. And I want you to be able to be alive to know that what is next, and what is happening, and for the family members too. It's that everybody that you want to be around and have been around, to be able to protect them.
We should go ahead too and note that there have been experts from not only from UAB, from other statewide organizations, from national and even international organizations that have repeatedly debunked that fertility argument that, again, we saw circulate on social media, and have said that this vaccine will have no impact on your fertility. If you have fertility problems, that could be from many of other things, but this vaccine has no proven effect on fertility problems. We have seen that. I wanted to go ahead and debunk that there, because like you said, we have seen this pandemic has been a health pandemic, but we've also heard it called a pandemic of misinformation. And that is something we have seen since March of 2020, or even before March of 2020, when COVID-19 was really circulating. Now, I want to get to a few more questions I've got here. One I had from Ed, and Ed says, do we know how long the vaccine, immunity is probably not the right word, but the protection against COVID-19 that kids get from their vaccine will last? We know that we've been talking about booster shots in adults, but what do we know about the vaccine for kids?
I think that is, that piece of that information is, down in the weeds of that, is still part of the ongoing studies. We do know that it protects for the projected length of time that the adults do with the Pfizer vaccine for that 5 to 11-year-olds, it is a smaller dose, and that's what, with all the safety precautions and measuring that and everything, but I'm forgetting the exact date that trials started with that in that age group, but that piece of it, long, are they going to need a booster? I think that likely they probably, will, just like adults and so forth. But exactly when, I think will be, kind of to be determined.
What have you heard about parents who want to make the argument of saying, look, kids get sick. They get sick a lot. It's part of their natural immunity, building that immune system, and the vaccine's stopping that natural immunity. What do you have to say to that?
You don't want your kids to get COVID. And I could tell horror stories and everything else. And yes, there are things that build our immune system. And one of those is a vaccine. You make antibodies, and the antibodies are what fight that when you're exposed to it. It doesn't mean that you're not ever going to get COVID. It means that you have antibodies on board that will help protect you from being in the hospital of varying levels. So
I liked the way you phrased that. Your first answer was just, look, you don't want your kid to get COVID. I thought that was important there. We do have a viewer from Karen who says she's worked in long-term care and worked in the COVID unit. Says this is not a joke, nothing funny about that. So Karen, thank you for your service there and working on the front lines, as well as you, Dr. Dye. Now, a couple of quick other questions I have, and one is about masks. Now we know that everybody's been up in arms about masks for a long time. It feels like. Now we see it. I hesitate saying it. I got a knock on my desk here, it's wood, to say it seems like maybe things are getting better. So when our kids get vaccinated, do they still need to wear a mask, especially if they're playing around other children who maybe you're not sure of their vaccination status?
Yes, I think for right now they do. Again, I'm as tired of masks as the next person, and I'm ready to not do that. But in order to not wear masks for the rest of our lives, and I'm saying that a little cliche, but maybe not. But in order to do that, then we need to vaccinate and mask, for now. And I think Dr. Walensky, with the CDC director, made a statement last week after the vaccine got the approval, the EUA, and she made the statement that they're here for now, but not for forever. Not being here for forever requires us to be socially responsible and to do the things that we know work for now.
Again, an answer that some people might not like, but do you think that getting our kids vaccinated, continuing to mitigate risks as much as we can, will keep us in the spot we are now, where we are not in the heat of that summer COVID wave that we saw earlier this year, or some of the other waves that we saw? We're doing, as I said, I want to knock on my wood desk here, a little bit better in terms of our COVID numbers. Do you think vaccinating kids is the way to keep that line going?
Yes. 125,000%.
And do you think that there is an argument to be said that only maybe a smaller portion of the population fits into that 5 to 11 age gap, that they are still noteworthy in vaccinating that population to getting us over more percentage levels of people being vaccinated?
Yes, absolutely.
And I read something interesting as well as in that study about the different thirds of parents and their views. I saw a very interesting line from a doctor, and he said that the thing about getting vaccinated is you can't get unvaccinated. So once somebody is vaccinated, that helps numbers, that helps percentages altogether.
Yes, and Ivana, I'm so sorry if there's construction. I'm really sorry that just happened. Um, and I totally did not hear your question completely.
I'm not even sure it was a question. It was more of a
Okay.
line of saying that somebody had, in a study that I had read, it said, the thing about vaccinations is once you receive it, you can't get unvaccinated. So
Okay.
those percentage numbers will continue to go up by even one person who gets vaccinated makes a dent in that percentage number. Do you agree with that?
Yeah, I mean, every little step, little person, older person, helps move the progress forward. And to be real honest, I have children, and they were fortunate enough to be included in trials, and one of them got placebo, and we knew that was a risk. But one of the things that we, thought about long and hard before we did it, obviously, was, what if they, do get the placebo? But what if they do? They're still, they are still helping science. We call them our heroes, and helping be that patient that is getting, allowing the trial to happen, allowing us to get to the point to where we do have, a vaccine for their age group. And when we got the when we got the vaccine, when the EUA came out and learned that one of them, was placebo, having that conversation, and then within that conversation, showing them pictures of other kids that were able, got the vaccine that morning or earlier in the week. She said, "Wow, I helped a lot of people get the vaccine." And it just was one of those moments. If I hadn't been driving down the road in traffic, I probably would have, boohooed. But it, just that realization and being able to be a part of that. So.
Well, look, our kids are superheroes in a lot of ways. I think we know that. Dr. Dye, thank you so much for all of your expertise here. I know that this has helped a lot of people and given a lot of information to people who really needed it, especially those who maybe don't have a trusted medical source to call on. So, Dr. Dye, thank you so much. If you have more questions about this, please feel free to email them to me. I'll drop my email in the comments here, probably easier than if I say it aloud, and I will get them to Dr. Dye or another professional to get them answered for you. So I hope this was informative. Dr. Dye, thank you again so much for your time, and we appreciate it. Everybody watching, we'll see you tomorrow.
Thank you so much.